round of applause.
Thank you very much. That was a very long couple of sessions. So I noticed some people getting up and moving around. Why doesn't everybody stand up for about 10, 15 seconds here and shake your hands and get your blood flowing here. I think what I have to say is something that you'll be gotten used to. Dustin knows an awful lot. I think he threw in everything from the kitchen sink there, but I know he had more that he could say. I want to thank Dr. Tammy for inviting me to participate with this illustrious group of speakers. I'm really glad to be here. And I'm trying to sort of rein in and control talking about everything under the sun. But I do want to mention in terms of the previous lecture, and I'll talk more about that later in the question and answer period. But as the previous slide showed, I have 49 years experience doing drug abuse treatment and prevention. That really has been sort of a part-time thing. I've worked at every level of government. And I've been split about half my time between clinical medicine in my career, and the other half had to do with bureaucracy. I'm here to talk about cannabis and post-traumatic stress disorder. Yesterday's USA Today, in the opinion page, said every 2 minutes a veteran commits suicide. I'm in correspondence with the head of continuing medical education at the VA in Long Beach, who is sympathetic to the idea of people who are on staff there understanding the medical utility of cannabis, particularly for veterans, and particularly for veterans who have problems with pain and or PTSD. In fact, there was a budget amendment called the Rohrabacher-Farr Amendment. Both Rohrabacher and Farr are California House of Representative members. Interestingly, Rohrabacher is one of the most conservative Republicans, and Farr is one of the most liberal Democrats. Now, if we can only get the people in the middle to go along with that, we will have something. That was in the budget until just the last minute. This was back in January or February when we looked at the budget, and it was taken out just at the last minute. I want to mention in the shameless commerce division of this talk, there are some flyers back there of my book, which is out in 2 volumes called Drugs Are Not the Devil's Tools. We've got a few of those books out when you're enjoying the van, and I'll be available to autograph them. One last thing I wanted to talk about is the American Academy of Cannabinoid Medicine. We started this about 10 years ago in an effort to recognize those doctors that are practicing good quality cannabinoid medicine. Can I have the next slide, please? And of course, you always have to be a little bit dubious of physicians as to how much we know. Just because we have MD after our name doesn't mean we know everything about everything. Unfortunately, sometimes it doesn't even mean we know anything about medicine. Can I have the next slide, please? So,
you can take the mic.
I originally started this having to deal with attention deficit disorder because some of the mechanisms of action for treating post-traumatic stress disorder are the same as that for treating attention deficit disorder. And in fact, they can be comorbid conditions. And they're probably both caused by a lack of free dopamine. I think we'll get into another slide here a little bit later that talks about the constituents of the endocannabinoid system. Can I have the next slide, please? And these are more patient testimonials in regards to attention deficit disorder. I have just as many testimonials in regards to post-traumatic stress disorder. And when it comes to post-traumatic stress disorder, many of my patients tell me that the medications that they were given by, say, their veterans, the Veterans Administration, or by their private physician, while it may have treated some of the symptoms that they had, the side effects were to make them feel like a zombie. And many of these patients had voluntarily stopped using the medications. Next slide, please. Okay, so we've gotten a little bit more sophisticated as to what we are talking about in terms of the horrors of war. In my opinion, human beings were not designed to fight. That is, if you end up getting the body parts of your best friend splattered all over you, the idea that you're not going to have some kind of negative effect from that is absurd. And the way that we treat our veterans, it's getting a little bit better. But after the Second World War, you had veterans who were made fun of. They were like a shell shock after the First World War. And nowadays we have a little bit better understanding. And I hope when I'm done with my presentation today that you'll understand the biochemistry. On the other hand, who cares about the biochemistry? What we care about is what can be done to help people, what can be done to assist people. And one of the things, obviously, that can be done to assist people who have post-traumatic stress disorder is to prescribe them cannabis. One of the other things that we can do to help people that have post-traumatic stress disorder is to listen to the words. Their medical problem, their psychological problem, came as a result of being exposed to a traumatic event, be it war or rape or tsunami. And this event has a profound effect on people and on the brain, and I'll tell you a little bit more about what I think that profound effect is. Can I have the next slide, please? So, this is an ongoing stress following a trauma. Next slide, please. And there are a pretty significant percentage of the population that have been exposed to these stresses. Can I have the next slide, please? And you can see the list of causes, and that's just a partial list, but one that we often neglect to take into consideration is being raised in a dysfunctional family. A person who has been emotionally, physically, sexually abused is very likely to have post-traumatic stress disorder. And I see this very frequently in my PTSD patients. Can I have the next slide, please? Soldiers obviously are put in a situation that is extremely stressful. They don't have to be on the front lines in order to experience that stress. Can I have the next slide, please? Oh. And as I said before, it's not just the military that have problems with PTSD, but also civilians as well. As we know, sexual harassment and sexual assault is extraordinarily common and extremely underreported. Estimates vary from 1 in 8, 1 in 4 rapes being reported to the authorities. It's certainly not 1 for 1. So we know that this is something that is unfortunately very high. Certainly happens a lot on college campuses and in communities that have people of college age. And I practiced in Isla Vista, California, which is right next to the University of California in Santa Barbara. And I was impressed with the number of patients who came in and said, Doc, I was raped, and you're the first person that I told about it. It happened 2 or 3 years ago, and this is something I just haven't been able to share with anybody. Can I have the next slide, please? Okay, so some of the symptoms you can see up there being hyper alert, having nightmares, easy startle. One of the ones that's really disturbing to people is poor impulse control. I can't tell you the number of PTSD patients who I've said now, have you had a circumstance where you've been out drinking with a buddy and then all of a sudden you start screaming at them, and that's the end of your friendly drink together, and about 2 or 3 hours later you're thinking, why did I do that? And I'm going to explain to you why a person with PTSD would do that. And the reason is that their midbrain, the most primitive part of the human brain, the reptilian brain, is more in control, is influencing our thinking more than is good for us. And the midbrain, while it's important for our survival, it sees life in terms of black and white, life and death. So everything becomes life-threatening. And the reason that the midbrain is more involved is that our neurotransmission is moving more rapidly than is good for us, so that the midbrain wants us to act, and when these neurotransmissions are moving really rapidly, there's not enough time for the more civilized, the more modern part of our brain, the newer part of our brain, the cerebral cortex, to step in and say, no, wait a minute here. Life isn't black and white. Life is shades of gray. Your life isn't being threatened. Just take a deep breath and step back. And when you tell that to somebody with PTSD, they say, yeah, that's exactly what I was thinking. When 2 hours after, yelling and screaming at my buddy, I'm wondering what the hell happened. Next slide, please. So, I mentioned that growing up in a dysfunctional family can lead to PTSD, and of course they have many of the same symptoms as adults that have PTSD, and these symptoms don't necessarily go away. Okay, the next slide, please. Now, there's a researcher named Daniel Piamelli, and of course, Dr. Sulak had a couple of articles that were written by Dr. Ethan Russo, and Dr. Russo knows more about medical cannabis than just about anybody in the United States. And one of the things that he talks about is an endocannabinoid deficiency syndrome. And this slide represents some of the problems that can be caused by not having enough of your own cannabinoids. Can I have the next slide, please? So lots of things can trigger a person sort of having a PTSD episode, although people with PTSD are troubled by some of their symptoms all the time, not just by these triggers. But there are people who have PTSD who are very uncomfortable around other people. I have a patient who lived, at the end of the road, 5 miles or 10 miles outside of Bishop. And those of you who are familiar with California geography know that Bishop is sort of at the end of the road itself, and this guy was 10 miles out of town at the end of that road. And he said that he went into town about once a month, less if he could avoid it, and that without cannabis, that he would probably start killing people. Now, he's gotten a little bit better. Don't worry when you go to Bishop, I think he'll be all right. Okay, next slide, please. So, we've got a variety of treatments. Medication and counseling have been two that have been widely used. There's another one that has been fairly helpful, and that's called extraocular eye movement reprogramming and desensitization. And when I first heard it, it sounded like the usual kind of California flaky stuff. You're stimulating both sides of the brain at the same time. You're using flashes of light. And I had a Vietnam vet who had come and seen me for about 5 or 6 years, and he would break down crying in 5 minutes, and he had agoraphobia, he couldn't leave the house, and he couldn't even travel a half hour to see his grandchildren. Then, about 6 years ago, 7 years ago, he came in and said, well, the wife and I went for a cruise up to Alaska. And I said, what happened? Your getting out of the house? He said, EMDR, extraocular reprogramming and desensitization. And you know, he said, I can get in the car now and drive a half hour and see my grandchildren. It's been a great help and a great improvement. And I've had a couple of other patients that have benefited from that. So even when something sounds flaky, it's not always the case. Can I have the next slide, please? So, you know, there's a lot of these medications. Some of those are antidepressants, some are mood stabilizers. And we love to throw medicine at a problem. And the worse the problem is, the more medications we're likely to throw at it. All of these medications have side effects. In fact, human beings have evolved along with plants. The endocannabinoid system, according to